Let's turn now to Karen Constantine, a Labour Kent County Councillor based in Thanet as well. Karen, thank you for being here too. I mean, what do you think we need to do going forward to give tangible help to households who are struggling?
I think there are some things that we could do, that solutions that we could implement quite quickly. I think the first thing to do is to recognise that this is a cost of living crisis that is impacting so many people. And as Jack Packman's just pointed out, working people on a wage of 20,000 a year now are struggling. And that's certainly been my experience here in Ramsgate, that many more people over the past 12 months, 18 months in particular, are starting to struggle. And they are people that are working. So I think one of the first things that we could do is we could look at the national minimum wage. You know, the current rate is £8.91. We could put that up. And also we could scrap the appalling age-based difference in the minimum wage, because if you're up to the age of 20, you're only getting £6.56. So I think we need to be looking now at implementing a national minimum wage of £10. You know, lots of employers have done well during the COVID crisis, lots of the retailers, etc. It's time now to put that money into workers' pockets. So that's the first thing.
What about the ones that haven't done so well? Would they have to do it as well?
Well, that would have to be looked at. But I mean, you're asking me what I think the solutions are, and I think work should always pay people sufficient wages so that they can actually, you know, put a roof over their head, eat well, and heat their own home. And if we can't do that, then where are we going as a society, to be quite honest? If people are working 30 hours a week and 40 hours a week, or doing more than one job, two jobs, couples working all hours, then they should be able to eat and heat. I think that's a kind of basic requirement of any society. Yeah. And then I think we need to look at those groups of people that are poor, so those people that are on universal credit. I think it was an absolute outrage that the universal credit uplift of £20 per week was scrapped, and that has plunged people into desperate poverty, where they're not able to heat their homes, they're not able to eat properly. They are now becoming ever reliant on food banks and handouts and charities, and that's really not the way to go. I mean, I think even before the pandemic, 1 in 5 people were living in poverty, and that was 4 million children. I went on about that at Kent County Council extensively, you know, because that is not the way to build a healthy society. That's building in cost further upstream. So they are immediate things that we could do, as well as looking at the windfall tax on energy companies, as well as making sure that we look at removing the VAT on energy costs to give people some immediate relief so they can actually warm their own homes and not make that dreadful choice between eating and heating, which I think is obscene in this day and age.
Karen, on that point about VAT, this is interesting. I don't know whether you heard my chat with Sir Roger Gale earlier on, MP, of course, for North Thanet. Now, he was saying he was initially in favour of it and then actually thought about it in more depth and said it's not the right solution because actually it benefits everybody across the board. It's not targeted. There'll be some people who can afford that at the moment, who have done well in the pandemic. What we want to do is help those people who are struggling.
Yes, that's right. I mean, he's talking about the 5% that have become, under his government, have become £3,500 a year better off during the past 12 months, 2 years, whereas we're talking about 50%.
So would you target that then, if you're in favour of moving VAT?
Mm-hmm. I think what we have to look at is the immediate need. And sometimes by doing a sort of global scheme, you can get money into the pockets of people very, very quickly. And I think that's why we're in favour of it, is because we could do this for 12 months and it would be done very, very quickly. We'd also look at using the windfall tax that's due in from the gas and energy creating companies to fund that. We're looking at a £1 billion windfall. So really, we would give that money out and then recoup that money, if you like, from the windfall from the energy companies. Right. That seems to me to be sensible. I think there's something about doing things on a universal basis. It is better to target. I do agree with that. But actually, what I would say to Roger is, what were his actual answers to this question? Because it's his constituents and Craig McKinley's constituents that are suffering. And I'm not seeing either of them actually coming up with any concrete answers. And I've just given you some concrete answers as to what the government could do very, very quickly: increase national minimum wage, reinstate the universal credit cut that they callously took away from people, and actually find a means of reducing these bills, and also look at how we can diversify our reliance on energy companies, how we can renew energy companies get into renewables and reduce reliance on say Russian gas, etc. And we've been calling for these measures since October. We're now into January. When are the government going to take action? This is a cost of living crisis. So many people now, so many people telling me about how they're being impacted. And it's right across the board. It's people that you wouldn't necessarily...
True. Can I just interject? Because you mentioned Craig McKinley. He is very clear, actually, about what he would like. He was on this show agreeing with you, actually, saying Labour would take the VAT away. And I guess the same reasons, actually. It's difficult to do targeted support. It's not quick. And we want a sort of quick fix here. He also said, and I'd love to know what you think about this, to remove the green levy on our energy bills as well. Now, that's a difficult one, isn't it, given, where we are with our climate emergency?
I think that would be really a difficult argument to justify in the short and the medium term, because, as I've just said, the one thing that we need to do to avert these spikes in energy prices, which are a global issue, is to kind of really obtain energy from a wider source, and that would include renewables. So if we reduce what we're putting into renewables, we're only creating a problem further upstream. So in that respect, I think Craig has been really short-sighted. I would much prefer Craig to come and meet with the constituents here to find out how much they're struggling, and to get into Parliament and to bang on the benches to get the universal credit uplift reinstated with immediate effect. Karen, because people are really struggling here.
Final point, but national insurance, of course, is going up in April. This is another very difficult one. We need that money to fund our NHS and social care. And yet, of course, as you know, households are squeezed. What would Labour do?
Well, I think what we'd immediately do is we would look at this current crisis, which the government have created. We'd look at the cost of living crisis, because it isn't unreasonable. It isn't unreasonable to say add something to national insurance for a problem that's a growing issue. That's not unreasonable, but it is unreasonable when every other cost that we pay as consumers is rising, from travel costs to our kids going to school. So
you wouldn't raise those insurance contributions in April?
I would postpone the raise. I would look at this as a real crisis, and I would see what we could do to keep money in people's pockets, and what we could do to add money to people's pockets in a targeted way, especially the very poor.
So how would you fund the NHS and social care? It's really difficult, isn't it? Because they desperately need money.
Well, I would stop funding the private sector's involvement in the NHS. One of the things that's happened in the NHS in the past 10 years particularly is the private sector has come into the NHS in the same way that we've seen rail coming into what was a publicly owned system, in the same way that we've seen water companies raking off huge profits from the bill payers. That exactly the same thing is now happening inside our NHS. And whilst ever we've got profiteers in there creaming off the profits from our illness, then we're not going to be able to grow the NHS in the way that we want. And actually, it was another short-sighted step by the government to cut the bursary scheme, which every single NHS, the nurses and the midwives, every union involved, all of the employers' organisations said, please don't do that, because you create a bigger problem upstream. And what do we now have? We have a massive staffing crisis in the NHS, predictable. And exactly the same is happening with the cost of living crisis now. That to drive people down into poverty, to force them into a situation where they can barely afford to eat or exist or pay skyrocketing rents, is absolutely obscene, and it needs to be stopped. And Craig McKinley and Roger Gale are our parliamentarians, and they need to take action on our behalf and not just play political games, which is what I think they both do.
Some people would say, OK, we've got, this private healthcare, but it does take some people out of the system. What would you say to that?
Well, those people that can choose to use private healthcare, I think you've got to look at dentistry as your model for this, because what happens is, as you may know, in Thanet, there are now no NHS dentists. So if you're new to the area, or if you haven't previously had a dentist, you've got to go private or into one of the co-pay schemes, and they are phenomenally expensive. And we're basically we're training the dentists, the taxpayer is paying for that. So the same thing will happen in the NHS, where the taxpayer is paying for people to go through training, it's paying for their subsidies to be, on rotation in hospitals, etc. And then when they come out, instead of like putting that back into the NHS, they're taking off the profits and going into the private healthcare scheme.
Interesting stuff, Karen. Look, we've covered a lot of ground. Thank you so much. Yes.
Thank you for that.
Really good to talk to you this morning. Yeah, I'm sure we will talk again on this point. But for now, have a good day and we'll speak soon. That's Karen Constantine then, a Labour Kent County Councillor based in Thanet, with lots of ideas about how she or Labour would tackle the cost of living crisis.